Nick Saki at Pure Storage. Let's talk about a specific use case that you'd like to highlight in regards to healthcare in the federal community.
Well, as we've discussed across this panel today, the volume and velocity of healthcare data has particularly accelerated throughout the pandemic. And what we answered the call for among our partners within the federal government and in private industry and across the state governments is how do we help them maximize, shorten the time to value on that data and maximize the amount of analytics and applications that they can apply against that data. So in particular, at the outbreak of the coronavirus, there was a tremendous spike in demand for analysis and sequencing of the virus itself. And we were able to partner with Health and Human Services and a couple of other agencies and companies to help increase the number of sequencing runs that they could perform per day, as well as do correlation and analysis of case data from across the country, and then helping to aggregate that data to produce the COVID dashboards. And we were doing this all off of literally a handful of different systems. But to bring that data together and to be able to serve it to a disparate group of application processes to help everybody from scientists and clinicians to policymakers have a unified view of that data and to be able to adapt their views of that data as the data changed really accelerated the acceleration of decision-making and obviously insight and awareness to the nature of the disease and ultimately getting to a cure faster. So it's one of those things where we build probably the least visible thing on a car. We build the tires, but it's what enables the engine and the driver to be able to perform, tremendously well in the race that is for curing these tremendously difficult diseases. So these are lessons that we learned from obviously cancer research and other areas of biomedical sciences, and of course, our support for and partnership with Epic and with Cerner in terms of electronic health records. It's simply making the data move faster in larger quantities to enable faster time to insight and faster response to medical care requirements.